The Business Planning Framework, otherwise known as the BPF, is a tool used for nursing and midwifery workload management. There are approximately 39,000 full-time equivalent, FTE, nurses and midwives employed with Queensland Health, which constitutes nearly half of the entire workforce. The BPF is a process to determine and evaluate the nursing and midwifery staffing and skill mix supply required to meet the service demand to provide safe, high-quality healthcare. By taking part in the delivery of the service profile and resource allocation, nurses and midwives can contribute to ensuring a high standard of evidence-based care. Ratios. As part of the BPF process, legislated nurse-to-patient ratios were implemented in prescribed Queensland Health hospitals in July 2016 through amendments of the Hospital and Health Boards Act 2011 and the Hospital and Health Boards Regulation 2012. In addition to legislated minimum nurse-to-patient ratios, each service will define its notional nurse-to-patient or midwife-to-woman ratio using hours per patient day or occasions of service they are required to provide based on the acuity and activity. As part of the BPF process, minimum safe staffing requirements form one of the considerations when determining staffing. Consistent with the provisions of the Nurses and Midwives Queensland Health Award, State 2015, the award, professional judgment is a valid criterion when determining minimum safe staffing. Compliance with any relevant legislative requirements is considered mandatory, and sound reasoning must exist for departing from any relevant professional standards or codes of practice. 3 principles of BPF. The BPF is underpinned by 3 principles which include Principle 1, safe and high quality consumer care. Principle 2, support and resourcing for staff to provide safe and high quality care. Principle 3, deliver of safe, affordable, sustainable and continually improving health services. The BPF process. The BPF process is undertaken annually aligned with the financial year and comprises of 3 modules which include Module 1, development of the service profile, Module 2, resource allocation, Module 3, evaluation of performance. Development of a service profile. The service profile outlines the demand required of the service. Developing a service profile is a process for examining a service and the environment in which it operates to identify the supply of nursing and midwifery resources required to meet demands. Service profiles are built from the ground up by reviewing patient activity, patient acuity, and historical data such as bed occupancy or occasions of service. Service profiles must include a service aim, which identifies the aim of the service in relation to the directions outlined within the hospital or health service strategic plan and/or service agreement. Service objectives, which identify the key outputs and measures that a service is aiming to achieve. Service description, which is a broad description of the service and provides context for identifying the demand. Internal environmental analysis, which include things like the physical structure, organisational governance, performance, benchmarking and forecasting, to name a few. External environmental analysis, which refers to policy, technology, research and evidence-based practice and the environment as examples. A SWOT analysis, which includes strengths, weaknesses, opportunities and threats. Resource allocation. Resource allocation is a systematic process for developing nursing and midwifery services to achieve a balance between resource supply and service demand. Adequate resource allocation ensures the effective and efficient management of resources, safe workloads and provision of quality healthcare. During this component of the BPF, a roster construct is built that aligns with the demand while determining skill mix. The roster construct provides a breakdown of nursing and midwifery hours required to provide safe patient care. The hours entered into the roster construct determine the full-time equivalent, FTE, required for the service to run. Backfill percentages are then applied to determine the maximum FTE the service can recruit to. This will also determine the maximum FTE allocated to be on leave at one given time. Evaluation of performance. Once the service profile has been implemented and the resources allocated, the effectiveness and efficiency of the services in achieving safe, high-quality nursing and midwifery services is evaluated. This evaluation process uses performance measures such as sick leave utilisation, risk-man incidents, employment diversity targets, and patient experience surveys, to name a few. Developing a low priority activity list. Key strategies to manage supply and demand include developing a low priority activity list. This list will be developed based on the professional judgment of the nurses and midwives in the service. The low priority list will be developed when completing the BPF and in conjunction with the nurses and midwives within the service. Implementing workload escalation process. The award determines the step-by-step process for escalating nursing and midwifery workload concerns. The workload escalation process assists staff and managers to effectively address and resolve any workload concern raised to ensure safe, high-quality healthcare services are delivered. Queensland Health and Queensland Nursing and Midwifery Union recognise that an interest-based approach promotes a relationship based on trust, allows the parties to search for mutual gains, manages conflicts of interest, maximises the opportunity to arrive at a fair outcome. There are 5 stages to escalating workload concern. These include Stage 1, where a nurse midwife identifies a workload concern. It will be raised immediately at the service level with the line manager responsible for ensuring the BPF has been correctly applied. Stage 2. If the workload concern is not resolved at the service level at Stage 1, it may be escalated for discussion between the nurse or midwife, union representative, and the nursing midwifery executive team, that is, nurse grade 9 and above, depending on the nursing executive structure of the facility. Stage 3. If the workload concern is not resolved at Stage 2, the nurse or midwife employer and/or union representative party may escalate for resolution. Stage 4. If the workload concern is not resolved at Stage 3, a specialist panel must be convened by the Hospital and Health Service Executive Director of Nursing or Midwifery or department equivalent within 7 days, or longer as agreed by the parties, of the concern being escalated from Stage 3 by a party to the concern. Stage 5. If the workload concern is not resolved at Stage 4, a party to the concern may refer the matter to the QIRC for conciliation and, if necessary, arbitration. Throughout this process, staff will be informed of the progress and the outcome. Workload concerns can be raised through the Workload Concerns shortcut. Talk with your nurse unit manager or midwifery unit manager about how best to contribute to the delivery of your service's BPF.